Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Today, we're going to bring you highlights of the annual seminar we hold on health equity in conjunction with Kearney. Today, we have a very distinguished panel who's going to speak to the topic of women's health. Kate Maheu, a partner in Kearney, starts the discussion.
I have been excited and energized by the women's health effort that Kearney has led over the last year since launching at Davos about a year ago now. It seems like it's been a lot longer given the discussion. We launched our effort at a global stage at Davos with about 50 signatories on our open letter around women's health and the important effort that's required in closing the gender gap. And now have about over 200 to 300 organizations represented in our women's health community. So if you're not yet a part, we'd love to get you included so you can get in the flow of our community discussions and ongoing efforts. Women's health is often looked at as fertility care, maternity care, menopause care. But really, women's health and the specific gaps that I think we're facing today are much more broadly focused on the holistic women's health journey. So I'd be interested, based on the different settings that you each work on or work in, to hear a little bit about the populations you serve and some of the most critical challenges that you see around gaps in women's care and women's health equity.
So our geography, again, is the west side of Chicago, roughly 550,000 people, primarily black and brown. It's one thing to put a West Side Healthy Parents and Babies program, which we have, which provides wraparound supports to birthing parents, access to care, and a laundry list of supports for that family. But if you're not thinking about the economic vitality and viability of women, how they're earning, where they're working, what they have access to for family-sustaining wages, if there are business owners, if there's access to capital. For us, it's a checklist of thinking about, yes, addressing through our partnerships the low birth weight, the preterm births, but also the entire spectrum. We want that baby to live to 100. And life expectancy in that community is around 72. So the work is around building the infrastructure within our collaboration, leveraging the partnerships that we have around the table to create a better quality of life. Right. So the work, when we think about also just the key drivers, if you look at cancer, cardiometabolic disease, opioid overdose, homicide, and you break that down by gender, or you look at the role of the mother, the head of household in some cases is a woman, there are implications for that come back to beyond mortality and morbidity that have implications for women in these communities.
Piggybacking off of what she said, there's a lot of research out there that shows that if women are empowered, that they create healthy families. So they don't just help themselves, they help their children, they help their spouses. That's not the same for men. Sorry for the few men in the room. As an emergency doctor, which is what my primary training is in, and that's about 3/4 of my job, we also see enormous disparities in things that come into the emergency department. So heart attacks, for example, much easier to diagnose in men. Why? Because all the studies are in white men. So all of what we know right now about how heart attacks present in emergency departments is based on studies in white men. So there's a reason we're not looking for the same kind of symptoms in women and why they're often missed. And so they're not just women's issues. Heart attacks happen to everyone, and we need to create better algorithms so that we recognize them more in women and can treat them better.
I think, talking about how women are often the caregivers in the family, and being a pharmacy and a grocery store, our customers shop in our stores 2.5 times per week. So the access we have, and a lot of times it is the woman of the household that's doing the grocery shopping. So we have an opportunity as pharmacists to really make sure, even if she's coming in to pick up prescriptions for her family, to have an intervention about, highlighting how are you doing, how are you taking care of yourself, and then also thinking about nutrition. And we've heard a lot lately about food as medicine, and what can we do to make sure that the entire family, including the female, is receiving healthy nutrition to help be more preventative and promote wellness as opposed to treating sickness.
So we just this April for Black Maternal Health Week launched with Lurie Children's Westside Healthy Parents and Babies, and so it is a wraparound support initiative to provide birthing parents with what they need to have a successful journey in pregnancy and then postpartum. So one instance comes to mind where we were at the launch event, Westside Healthy Parents and Babies, in the Austin community. We had a panel where we had a doula, some physicians on the panel, and there was a young lady who was expecting, sitting in the second row, and it was time for Q&A. So this was April, the baby was due in June, and she had not had any care. So at this event, she could sign up right in the moment for care, get wraparound supports, and she stood up to give a brief testimony, and what she said was, I have not gotten care because with my first baby, I thought I was gonna die. So I didn't feel like I got the care that I needed. It wasn't a welcoming experience, so here I am. Mm-hmm. And so that was a moment, right, of just reckoning and realizing the reality. And this is in Austin, again, that has a high rate of low birth weight, preterm births. For us to think about in real time, just seeing that play out, but also in real time, being able to wrap our arms around that young woman as a community. And from there, she was able to access care. She did have a healthy delivery. She is continuing, but that's just a microcosm of what we see. And what that is based in is mistrust. And so in our work, it is about building bridges, doing reparative work. That young lady, there are hundreds of her.
You hear so much about what's the role of women in advocating for themselves in the healthcare setting? What prevents them from doing that kind of self-doubt of, do I need to be seen? Do I have the time to be seen? And importantly, what, as healthcare providers or participants in the healthcare ecosystem, do we need to be putting in place to allow that empowerment?
I mean, I think, again, because women are often the caregivers and they put everyone else first, it almost seems like selfish. Oh, I shouldn't be, I need to be making sure that everybody else is okay before I am. So I think as healthcare providers, making sure that we're knowing, I think, again, pharmacies are perfectly positioned because we know our patients, we know, where they are in their journey, and understanding, okay, this person needs a touch point, and it needs to be very personalized based on their situation. And I think, right now our healthcare system is set up very much like, this is the plan that you have, these are the benefits that you get, and if we can get to a place that's much more personalized, and again, we're seeing this a little bit with some of the healthy benefits and different options, but allowing people to kind of personalize their plan for them, and not just dictating this is what needs to happen. And then again, leveraging pharmacists and other healthcare providers to prompt the question, is everything okay? Right. How are you doing?
I see women every day in different journeys on their healthcare journey. And speaking about postpartum, I had a patient last night. I got off my shift at midnight last night. I had a patient last night who was 35 and just had her first baby and was suicidal from postpartum depression. She had a nanny, she had a full-time job, she had a fully active husband, and she was sitting there with me just crying, like just hysterical. She made me cry. And what I try to do in these moments, and it's only one patient at a time, is talk to them about how important this is, how important it is that she is here, that she is advocating for herself. How on earth could her baby be healthy if she's not healthy? How on earth could she provide for her husband or her job or any of these things? And so I think, moving forward, it is a cultural shift. It's so hard to change culture. What I try to do as someone now, moving through as now a leader, previously a learner, is to share my experiences, to talk really openly about these issues, to tell people, I know so many women who have postpartum depression, to tell these kind of stories, because it's become this thing that's stigmatized, where you feel like there's something wrong with you. Like if you can't get pregnant, there's something wrong with you. If you have postpartum depression, there's something wrong with you. You're not handling things correctly. No, that's not true. This is not normal life experience. It's also not normal to work full time while trying to do all of this. And we don't provide family leave in this country the way that we should. So I think that talking openly about these things is really important.
I also think about, on a personal note too, my grandmother, maternal grandmother, who passed away 2 weeks after being diagnosed with cervical cancer. And what I think about is that she was in church 8 days out of the week, right? So if there was a community health worker or someone there to encourage regular doctor's appointments, et cetera. So when we think about the social capital within these communities, where community exists, like churches, other spaces, to have that dialogue across the different actors in the spaces, that does bring about, I think, has the potential to help raise up some of the issues. There would be immediate opportunities to position for care and wraparound support. There has to be that deep introspection on how there can be corrective action so that people have trust in coming to their institutions.
What can we do? Well, I mean, if it hasn't been obvious from some of my answers, we should have public health insurance. I think everyone needs to have access. If we don't have everyone with access, how could we possibly expect them to manage these things on their own? So I think like expanding access, working on policy that expands access. Luckily, we are in a state that has expanded like CMS, Medicaid, Medicare, but there's still a big gap.
Community, the end user has to be part of the process. Whatever you're building for them should be informed by them, should be driven by them, and that's also what we've seen in some of our successes in activating catalytic investments in the region, like the Sankofa Wellness Village.
Yeah, I would just say I think there needs to be a shift, from our current, like we're very much reactive instead of proactive, and as when we look at healthcare and focus on wellness as opposed to treating sickness. I mean, there's always going to be sickness to treat, but investing some of that time, effort, energy, and money on the front side as opposed to waiting till things are where they are. And I think, we heard a little bit about ACOs and having everybody have some skin in the game and being reimbursed based on the outcomes that you're able to impact would be a good start.